Michelle, thanks so much for being here today. I can't wait to get to know you better.
Oh, no problem. Thank you for having me.
You're welcome. There may be some viewers out there who have not met you, so tell us a little bit about your background and how you got to Novant Health.
Well, a brief synopsis. I've been a respiratory therapist for 13 years, and in that 13-year career so far, I have worked in all different types of facilities, 900-bed facilities such as the Shock Trauma Center in Baltimore, Maryland, all the way to our smaller facility at Brunswick, and anywhere in between. I've taken care of adults, neonates, pediatrics, and all kinds of different patients.
Yeah. Well, how long have you been with Novant Health?
I've been with Novant for 9 years. 5 of those years I kind of just worked on an as-needed basis and came on full-time about 4 years ago.
Well, great. We're excited and we're happy to have you, and we're excited to learn more about respiratory therapy services at Novant Health. So tell me what types of services are included in respiratory.
Respiratory it's so wonderful because there are so many different things that we do. We not only do what a lot of people know us for is breathing treatments.
Right.
We take care of patients who have lung issues and need breathing help, but we also run and manage life support. Patients who need advanced airways, we take care of that, whether invasively or non-invasively. We do EKGs on an outpatient or an inpatient basis. We also draw blood, run arterial blood gases for physicians. We have at Brunswick a fully functioning PFT lab, so we do most of those on an outpatient, but also an inpatient basis. We attend all C-sections at the hospital, taking care of the baby and the mother if needed. So we really do have a vast array of duties that we perform at Brunswick.
Seems like it would not be boring. It would be, there's so
Absolutely
many
not.
things going on there.
Yep.
Well, you mentioned PFT. So let's talk about that. Let's tell our viewers what PFT means.
Sure. So PFT is a pulmonary function test.
Right.
And in pulmonary function test, we do a bunch of breathing exercises.
Okay.
And in those breathing exercises, we do lung volumes and spirometry. Your lung volumes will let people know if they have any restrictive, or your physician know if you have any restrictive diseases. And our spirometry will let them know how well you're exhaling your air. So you take it in and you have to get it out. And sometimes people have a hard time getting it out. And so those PFTs help your doctors know how your lungs are functioning appropriately.
Well, you said spirometry, and I think I know what that is, but tell our viewers a little bit about that. I think it's that little thing they give you after you've had surgery that you have to breathe in and and out stuff. So talk to me about that.
So the incentive spirometer is, when we give it to our patients, we tell them it's their breathing toy. You know, a lot of patients know about it after their surgery. We have them take in a slow, deep breath and hold it, and then exhale. What this does is it works the lungs, so after surgery, especially if you're laying in bed a lot, we don't want patients to get pneumonia. And if they have anything in their lungs, it will also help them cough it up. So it's a series of breathing tests that we have them perform, especially after surgery.
Are the patients that you see, I know you've talked about seeing them in the hospital, are there also treatments or services that you provide on an outpatient basis?
Absolutely. We had mentioned the PFT before.
Yes.
Most of those patients are seen on an outpatient basis, but we do some inpatient. EKGs, our therapists take care of those on an outpatient basis, as well as arterial blood gases. We draw blood on an outpatient basis if a doctor deems it necessary. So we do actually do quite a few duties for outpatients as well.
That arterial blood gas studies, what does that tell you? What kind of information do you get from that?
So in short, the arterial blood gas will let a physician know how well your body is participating in gas exchange. And there could be a multitude of reasons why it's not, but those values let them know what procedures you may need, or diagnostic, is a diagnostic tool to let them know what else you may need to get better.
I see. I know that in the past, I go to a lot of health fairs, and I see you folks there, and you do oxygen saturation testing?
Yes.
Tell me about that.
So when you have your oxygen saturation tested, what we do is we put a device on your finger, also known as a pulse ox, and it sends a little light through your finger. It doesn't hurt, and it reads how much oxygen is on your red blood cells. Now, if it's low, this could be for a multitude of reasons, but we like to keep it greater than 94 in healthy individuals.
Yeah, I've had that done. It doesn't, you don't feel anything.
No.
You just Yeah. Well, how about your team? I'm interested in who your team, who is that? What do they do? How does that?
We know, Ms. June, I think we have one of the best, if not the best, respiratory team in the area. Our team consists of therapists with multiple decades of experience. Therapists such as myself that has trauma experience. I have therapists who have worked in cardiac units, running balloon perfusion pumps. Therapists who were directors at other facilities. Military experience.
Yes.
So, and then, difficult airway specialists. So we really do have a lot of experience on our team.
How do you become a respiratory therapist?
So most people's respiratory experience or education starts with an associate's degree. It's a 2-year program. It's an associate's in applied science for respiratory services. And then once you get that 2-year degree, you have to sit for a series of exams. And you have to pass those exams to get your credential in order to get your license for the state of North Carolina or any state.
Any state?
To practice in that state.
What does a typical day in the life of a respiratory therapist at the hospital, what does that entail?
The best part about respiratory therapy is there are no typical days. But it does start out with our therapist getting an assignment. Usually one therapist, we run 2 therapists a shift, so it's staffed 24 hours a day. And our therapist will take ICU, PCU. They will take care of all the patients up there. That's where the advanced airway comes into play, monitoring them. They will also go to the emergency room or any high-risk C-sections that may come about. The next therapist will take the medical surgical floor. These are our patients for our breathing treatments, the incentive spirometer that we spoke of earlier, taking care of all that, going through coughing techniques for them so that they can make their lungs healthier.
Teach you to cough?
That's right. And cough effectively so that a lot of people don't use their whole lungs to cough. And so teaching them how to do that effectively so that they can get better.
Wow, that's a busy day. There's a lot of different things. Well, that's great information. It's been a pleasure to have you here. Is there anything that you would like to add about your department or your team?
No, I think we covered the bulk of what respiratory do, especially at our facility, and that we really do play a vital role in not only getting patients healthy, but keeping them healthy also.
Keeping them healthy, yeah. That's great information, Michelle. Well, if patients have any questions about any of these services, is there a number they can call to get that information?
Absolutely. I welcome all questions or concerns about our respiratory program at our hospital. My phone number is 910-721-3022.
Great. Well, thank you so much for being here
You're
today.
welcome.
It was a pleasure to getting to know you and to learn more about what you do.
Thank you so much.
Thank you.